So I'm really happy to introduce to you Dr. Maria Espanol, who comes to us from after finishing her training in pediatric hematology oncology at Louisiana State University in New Orleans. She's been trained by some of the best people in hematology, has great experience, has a particular interest in bleeding and clotting disorders in women, and she'll enlighten us a little bit about some of the basics of that and what we're doing here at BCDI. So
Thank
Dr.
you.
Espanol.
Thank you for that introduction. Hi, I'm Maria Espanol. I speak Spanish, but that's also my last name. So let's talk a little bit about women's health. So let's define what is a bleeding disorder. I think that's very important. So briefly, bleeding disorder is a health problem that makes it difficult for a person to stop bleeding. Okay, our body is perfect. So we have something that is called the coagulation system, that basically what it does is that prevent bleeding, but also controls bleeding when it's happening, okay? So this system is basically made of platelets that are sticky cells. Those are the cells that when you have any type of injury, they stick in that side and stop the bleeding. Then we have what we call the coagulation factors that Dr. Tarantino spoke about, that I like to call them chemicals or just proteins. And those coagulation factors help the platelets to stop the bleeding. Basically, they make that clot very strong. And then we have the blood vessels. We all have also blood vessels. And I like to refer to the blood vessels like the road where the blood flows. So these three components needs to work together and perfectly, so we can prevent or control the bleeding when it happens. So who gets bleeding disorders? Men and women can get bleeding disorders. However, they are more recognized in girls. And this is because we go through what we call the physiologic challenge in our life. And basically, this is just tests. So when we have our first menstrual period, we are testing our body, okay? And when we get pregnant, we also are testing our body. And these are the times in a girl's life or a women's life where when we most of the time diagnose the bleeding disorders, okay? So that's why, again, it can happen in both, but are more recognized in girls. So how can I tell I have a bleeding disorder? Or what are the first things that can make me think about I have a bleeding disorder? As I said, we go through what we call the menstrual period, right? So if you see that yourself or your daughter or your aunt or your friend is having a menstrual period for more than 7 days, that should be a red flag, okay? But also, if you are having overflow, that means that during the day, you have to change your pads or your tampons every 1 or 2 hours, but also you're sleeping and you need to wake up in the middle of the night because you have blood, right? Overflow. And you have to change your clothes. Those are also red flags. And of course, if you're having a lot of clots and they are big clots, larger than a quarter, that's also a red flag for a bleeding disorder. And I mean, you can have all of them. Usually you have all of them, but you may have just 1 or 2. So if this is happening to you, you should go to your doctor and ask for a referral or more evaluation, okay? So why we get bleeding disorders, how we get bleeding disorders. So we can born with bleeding disorders. That means they pass down from parents to kids, but also through our life, for any reason, we can get sick or we can acquire certain conditions that increase our risk of having a clotting disorder or make us to have a bleeding disorders. Especially if you have any disease in your liver, thyroid, and also if you are taking certain medications that can also increase your risk of bleeding. And I think I mean, it's important always to know what's going on with you, but I think, knowing that you can pass that bleeding disorder to your kids or to the next generation also is very important. So what are other symptoms of bleeding disorders? Where if you have a family member or you are having multiple bruising, if you have frequent nosebleeds that are hard to stop, also that's also a symptom of a bleeding disorder. As I said before, if you're having heavy menstrual bleedings, that also needs more investigation. If you see blood in your urine or in your stools, that also needs evaluation. Sometimes you don't have any of these symptoms, and the only symptom that you have is anemia. And that's how we start the workup, and we find out that you have a bleeding disorder. So that's why kids that have persistent anemia, even with treatment, they need to be worked up for a bleeding disorder. And also, if you have bleeding after dental interventions, after any injury, and it's a prolonged bleeding, also that can be a sign of a bleeding disorder. So how we diagnose bleeding disorders? We do physical examinations, as Dr. T said, Dr. Tarantino said, sorry. Basically, based on what we find in the physical examination, we can guide our workup, and also with blood tests. The only way that we have to test for these bleeding disorders is with blood, because they are bleeding disorders, right? And I always like to say to my patients that the diagnosis of bleeding disorder is not straightforward. We may have to test several times until we have a name and a last name for what is happening to you, okay? And the reason is that a lot of these proteins are stress hormones also. So if you are in any type of stress, that means you're having a heavy bleeding, that's a stress in your body. If you're pregnant, that's a stress on your body. So what your body does is that increase these proteins. And if I test during those moments, they are going to be probably normal, okay? I always tell my patients also that we always love to put a name and a last name for what is happening, and we love that. But sometimes, again, it's not straightforward, so we need to keep testing. And sometimes we don't have names for what is happening, okay? And we just treat. So how bleeding affects pregnancy? You can have anemia if you have a bleeding disorder, okay? Because it's one of the way it can present. Also, you can have very dangerous bleeding after birth, okay? You can have complications during the birth also that can affect not only yourself, but also the baby. So our roles as providers is not only take care of you as our patient, but also of your baby to make sure that when they are born, they don't have any complications because of the bleeding disorder that mom is having. So how we treat? We have the different ways to treat bleeding disorders. We can use hormones. Basically, what hormones does is that they increase those proteins that are low in our body. And again, if you have more of these proteins, hopefully we can prevent bleeding, okay? If you have anemia, we can treat the anemia with iron. Also, as Dr. Tarantino mentioned before, we give you what you're missing with clotting factors, okay? And those clotting factors are going to depend on what type of bleeding disorder you have. And we have this medication that we use very often, that is the antifibrinolytics medications, that basically what does is that it makes the clot strong and it prevents the clot to dissolve, so you can prevent bleeding. So what happens if you don't treat your bleeding disorder? Again, you can have anemia because you can bleed, okay? Your quality of life can be affected, especially because you may miss school, work. If you have any type of bleeding, especially in your joints, you can have arthritis or destruction of the joints. And of course, you can have severe bleeding that can be life-threatening, especially after surgery or childbirth. Finally, all these are well-known organizations through this country, but around the world, where you can always get information about your bleeding disorder. Thank you.